This is the BetaLife show, brought to you by Better Care Limited. Of course, you already know that this show is a place where you can get better health information for you to live a better life. I'm your host, Dr. Harit, and I welcome you to this special episode. I'm sure a lot of you are asking that, why am I not in the studio? Of course, I'm in a different place, and it's good to have a change of environment. All right, so today we are going to be discussing a very different topic. We are going to be taking a spin to a different topic, and the topic we are talking about today is medical tourism. Now, the question is, what exactly is medical tourism? You know, we are talking about, is it just to travel abroad, or is it to, what exactly is medical tourism? That's what we are going to discuss today. So, medical tourism or health tourism actually refers to the act of seeking healthcare services or fulfilling health needs across international boundaries. Medical tourism has now become a global culture, prompting people to seek healthcare in other places besides their own country. And this actually happens for several reasons. Now, medical tourism is also quite unique in the way it is, in the actual sense, because it's a combination of two sectors, both healthcare and tourism. Now, there are several driving factors for medical tourism, which actually makes it a multi-billion-dollar industry as it is today. What really makes this topic quite interesting is the fact that medical tourism was once thought to be driven only by people seeking or traveling to seek care in other developed countries, from lesser developed countries. But now, that is not the current reality anymore, because in recent times, it has now been shown, a lot of research has actually shown that a lot of people travel from more developed countries to less developed countries seeking healthcare services. And this actually happens because of lower cost considerations, because of improved standards of healthcare in these particular countries, and reduced treatment times in these less developed countries. Sadly, Nigeria's contribution to medical tourism, as with anything else, has been driven by bad actors and bad factors. In fact, according to a 2016 report by PricewaterhouseCoopers, it has been said that Nigerians spend $1 billion, that's approximately 500 billion naira as of today, on foreign trips abroad for various forms of illnesses, different forms of treatments. Now, this is about 20% of the total government spending, total government expenditure for health every year. Now, when we look at it, we now say that the deplorable state of public health facilities, the increased loss of skilled professionals, the lack of rare specialists, and poor motivation and organization of health workers are all factors that have actually contributed a great role in this bad situation of Nigeria's health system. However, that's not what we are going to be talking about today. We are just going to be talking about the impact of medical tourism and why medical tourism is actually important in our society today. And on this episode, I'm privileged to have Dr. Harit Chaturvedi, who is actually a renowned surgical oncologist and a well-acclaimed surgeon oncologist. He is actually the president of the Indian Association of Surgical Oncologists and the immediate past president of the India Society of Oncology, and is currently the lead surgeon of the oncology team at Max Healthcare. So I had a virtual conversation with him, and this is actually what happened. Take a listen.
Hey. If you're thinking about seeing or having seamless access to a medical doctor, having a better healthcare service, or even meeting a health specialist, then you are probably wondering, do I need to go through the stress of traffic and spending so much time just to see a doctor? How about the long queues and overcrowded corridors at the hospital? How much money do I have to spend? Well, you don't need to worry, we have got you. With Better Care, you can talk to a highly competent and unbiased medical doctor through video, audio, or chat. Better Care gives you access to professional prescription, drug delivery, lab orders and bookings, unlimited access to specialists, seamless payment methods, secure payment records, and so much more. Our goal is to improve patient engagement, satisfaction, and general well-being by providing secure and safe platform, 24/7 advanced care, affordable pricing, and holistic care. Sign up today. Talking to a medical doctor has never been this easy. Everybody deserves better care.
My name is Dr. Olawale Ogulano. I'm a medical doctor, and I'm the host for Better Care. That's the TV show. So, and we just have a few questions. We are discussing medical tourism and the impact of medical tourism in healthcare globally. So that's why we are having this conversation today. And I'm so privileged to have you. I know I'm quite aware of your accomplishments as a world-renowned and internationally well-acclaimed surgeon. That's a surgeon oncologist, and you're currently the president of the Indian Association of Surgical Oncologists and the immediate past president of the India Society of Oncology, and you're currently the lead surgeon of the oncology team at Max Healthcare. It's a privilege to have you here, Dr. Harit. Good afternoon.
Thank you, Dr. Olawale. Thank you for having me. It's really an honor for me to talk to you and to your people there.
Thank you. Thank you so much. All right. So I don't know if you're ready. I will just have a few questions that I would like to ask you in our conversation today. All right. So the first question I would just ask is about Max Healthcare. How has the experience been for you at Max Healthcare, managing patients both locally and internationally, especially during the past pandemic period?
So Max Healthcare is the second largest private healthcare in India. And within Max Healthcare, oncology is the biggest program. In fact, Max Oncology is the largest oncology practice in private sector in India as a whole. So we have a very large team. We have close to 140 oncologists. And we are spread over about 8 institutions. And 5 of these major institutions are in Delhi.
Wow.
And it's a very, very comprehensive program from prevention to palliation. And our program is organ-based. I'll discuss about that later. But to answer your question, we are treating regularly almost 25,000 cancer patients year on year, every year.
Wow.
And during the pandemic, while the international flow was affected because of the travel, but our domestic flow was interrupted in between when the peaks came. Otherwise, during the post-pandemic, post-peaks, even after the first peak and then the second peak, even then the work and the flow and care of patients went uninterrupted. So I must say that first and foremost, because of the nature of disease, people cannot sit back, they want to visit hospitals, and our frontline workers, not just doctors, even the paramedics and the nurses and the reception people and the whole machinery was actually fully on flow. And I must take this opportunity to emphasize that Max Healthcare played a critical role in addressing the pandemic challenges for the country as a whole.
Wow.
So at one point, we had close to 2,000 beds dedicated to the COVID patients.
Wow.
So, and a lot of trials, a lot of academics, a lot of research came out during that period. And Max team, the Max medical team, the intensive care team and the lab team came out with a lot of data and publications to give insight into the disease and also to create better strategies into the future. So in fact, during this period, close to 30 trials were done at Max Healthcare. So I think pandemic shook the whole world. But I think every nook and corner, the human spirit came out, that we all fought back with full resilience, whether we are in India or Nigeria or USA or any country. And we saw this human spirit all the time coming on the surface. So a lot is happening.
Yes, I'm really glad to hear you say that, and that's the reason why we decided to also have this conversation with you. Now, the second question that I would just want to ask is about medical tourism regarding Nigeria. In your own experience, because I know very well that you have managed cases of people coming from Nigeria, what are the frequent cases, in your opinion, from Nigeria here? What are the frequent cases you get to treat?
So I have also personally visited your country and I participated in your conference. Yes, yes. So I've been there, and I know that we have got a very robust clinical backing there, and you are a medical person. I'm sure you know what is happening. So the point is that what we get to see here from Nigeria, I've treated patients of breast cancer, ovary cancer, colon cancer, even lung cancer. Wow. I don't recall a oral cancer. Oral is something very common in northern India, but not from Nigeria. But what we have treated, breast, ovary, colon, lung, wow, kidney tumor, so all these things, even sarcoma, pelvic sarcoma. Yes. So wide range of patients we have treated, and we have used the synergy between our teams here and people back at Nigeria. So occasionally, few of my colleagues have gone there, done OPDs and seen patients there. And when we have to do surgery or some intervention, it is managed here. Some chemotherapy is managed in India. Sometimes some part happens in Nigeria. So the whole intent is to make sure that we make everything possible for the common man, common people, as much as we can. We know the limitations. Not many people can travel, and cost issues come up. So I'm not saying that it's all absolutely simple, but the attitude and the intent from our side is to really, really collaborate to bring best technology and knowledge and serve the people in the right spirit.
Wow, thank you. Thank you.
My name is Dr. Alfred, and I'm a pediatrician. Nowadays, I get to attend to so many children, and it gives me so much joy and fulfillment knowing that I get to take care of my patients.
Adding to the fact that at least 60% of individuals who seek urgent medical attention can get the same quality service at the comfort of their space without hassle or the fear of spending the whole day at the hospital.
Doctors are easily accessible while patients get better care. Sign up to our website at www.bettercare.ng.
Better Care.
Revolutionizing doctor-patient relationship.
Thank you so much. The next thing I would just like to ask is, because of your vast experience, I just want to ask, has medical tourism in any way, has it had a positive impact on improving global healthcare standards? Like, has medical tourism really affected us positively?
So I think this has a huge impact on global healthcare, huge impact. And the reason I'm saying that is, so medical tourism starts everywhere as people traveling for treatment.
Yes. First
they start for treatment. Then the collaboration starts between the medical fraternities. The two medical fraternities start talking to each other. And then the transfer of technology and knowledge happens, sharing happens. Today we do conferences with doctors in Nigeria. At Max Healthcare, we run a regular oncology program every month with the medical college students from Nigeria.
Wow.
So all this is happening because there is a relationship and there's a trust level. Yes. Your doctors know what is happening here. We know what is happening there. So I think the medical tourism plays a critical role in improving the bar of global healthcare. Yeah. And obviously, initially it affects only the critical patients and everything, but gradually the whole ecosystem starts changing.
Yes.
And for example, we have benefited hugely by technology. A lot of our doctors have been trained in US, UK, and all these places, which is ahead of us. Today, I can say with a lot of humility that the medical training in India is almost at par with the best in the world, because all technology, knowledge, everything is so easily available. And I'm sure the same things will happen everywhere in next couple of decades. It may take less than 2 decades, but it will certainly happen within the next 2 decades. And all we need to do is keep the focus on the common man, on the patient, on the real people who are suffering. We are all fellow human beings. Whether I'm in India or in Nigeria or any other place, if you give me a clinical situation, I'll give you the best possible result without any expectation. The real result is that whether the person will benefit or not. That is the real measure.
Yes, yes. And I think that's fantastic. And most of our viewers, especially for those that will be, those that are going to be watching this show, because they don't really understand that this exchange that you talk about, where, doctors in India are having conversations with doctors in Nigeria, and then this, this can be replicated in other countries, developing countries, as in contact with the developed world. This has actually brought a lot of improvement in healthcare. For example, just a few days ago, we heard that malaria vaccine is now available, and it has entered clinical trials, which is a very beautiful news for a malaria endemic country like Nigeria. And we also hear that HIV vaccine is on the way, and it's because of this exchange of ideas, exchange of ideals, that we are able to have these conversations that are making our patients better.
I have twice attended a physical meeting in Nigeria with the doctors there, and on virtual platform also, I think 2 times only. Yeah, 2 times on virtual platform. Wow. And really the exchange gives me a lot of comfort and confidence that we are all together in this. Yes. That is the main thing.
Yes, that's the main thing. And this is what takes me to the next question. Because you're a world-renowned oncologist. The question I just want to ask is quite simple. Is there any benefit of vaccination for patients with comorbidities like cancer? Are there any advantages and benefits for them?
You mean the COVID vaccine?
Yeah, well, yes, even looking at the COVID vaccine, yes, of course.
Okay, so if you're talking about the COVID vaccine, everyone should have the vaccine. Everyone should have the vaccine. Today, the pandemic is behind us, thanks to the scientists and the researchers who made it possible to have the vaccine so soon. And the only thing for people who are on treatment is that we want a window of at least 10 days on either side of the vaccination.
Okay.
So suppose you're on chemotherapy, don't take the vaccine within 10 days on either side of taking a shot of chemotherapy. If you're on radiation therapy, don't take the vaccine within 10 days of starting your treatment or ending your treatment. If you're planning for a surgery, don't take your vaccine within 10 days of surgery or post-surgery. Because at these points, the body's immune system and everything gets interrupted. So we do not want that inflection point to be interrupted by the vaccine. So these 2 interactions, how they will behave, we really don't know. So this is the formula with which we are working, that our patients, we encourage everybody for the vaccination. We just do not want the main treatment to be affected. And that is how it works.
So just to round this up, because this will be my final question, what are your final thoughts as regards this topic, medical tourism and the benefits for healthcare in particular, based on your experience? What are your final thoughts on this?
So my thoughts on medical tourism is that medical tourism should be the people travel only for good health. Okay, they travel only for the healthcare challenge. They don't travel to see the city or the countryside or anything of that kind. So first and foremost, the focus should be on good care on as least a cost as possible. Because we have to understand that people who are traveling, you have to increase the number of people who can reach out. So this is step number 1. Good healthcare at reasonable cost, as minimalistic cost as possible. Now, this can be different for different countries and societies and contexts, but that is okay. I'm just giving a general principle. Number 2, medical tourism should not stop at just patients getting transferred. It should help in building the bridge between the medical communities. Number three, it should gradually lead to building the institutions of right values and with infrastructure and support in the host country also, in the country where the tourism is, the patients are traveling. We should gradually be able to provide healthcare to people where they live. In India alone, for example, you can call it medical tourism within the country also, because a lot of remote areas in India do not have a lot of health facilities. But the government or the society should not stop just because they can somehow access. We have to provide access in their native area, in their native place, and that should apply to medical tourism also. So they should be looked at the whole thing by these three levers: patient care, healthcare collaboration between professionals, and providing the right info in the native.
All right, thank you so much, Dr. Harit. It's just been a privilege having you here and having these conversations with you. In the next, what is the next? The question I just want to ask now is, what's next for Max Healthcare? What's the next thing? Because Max Healthcare, they seem to be a leader in medical tourism. What is the next thing for Max Healthcare?
So our chairman very succinctly puts it, we want to be the most regarded healthcare. We want to be the most respected healthcare. That is our motto. And that respect or regarded healthcare comes only by quality care, by building trust, by building bridges, and providing the best which is possible anywhere in the world. As we build that, what is possible, best possible anywhere in the world, people will trust us. And that is what is our commitment. And I think he's a very big dreamer. He dreams really big, and we are in the situation to build not just the biggest healthcare in India, we will very soon be the biggest in Asia, because we are actually on an expanding spree also, and we are expanding our institution every day. More professionals joining us, the best people joining us, and that is how this institution will be built.
All right, so thank you so much, Dr. Harit. And it's been a pleasure having you on this conversation.
I really enjoyed talking to you, Dr. Olawale. I really felt privileged and honored. And thank you very much for having me on your show.
It's a pleasure and it warms my heart. Thank you.
So we have come to the end of today's episode. I hope you were able to learn something from my conversation with Dr. Harit and how medical tourism can actually affect the economies of two countries. You can reach out to Better Care anytime, any day, and definitely we can still continue this conversation on social media. Why don't you reach out to me there? Let's continue these conversations if you have any questions. And definitely Better Care is a platform that revolutionizes doctor and patient's relationships. So from the comfort of your home, you can definitely reach out to a doctor and have a conversation with a doctor. You can book doctor's appointments and speak with a doctor if you actually need to see a doctor. So make sure you follow Better Care on their social media handles and continue these conversations with them, ask them questions, meet with a doctor, and make use of their platform. So until next time and next week, I've been your host, Dr. Olawale Tokunbo-Ogulano, and I've been so happy to take you on this ride. I'll see you again next week, and make sure you stay safe and stay healthy. Bye-bye for now.